Welcome. This is going to be the basic setup. This is going to be the setup that you're going to be responsible for from here until the end of the program. The thing that is going to change is going to be the surgical case, and we'll do that demo on those Wednesday demo days. So what I'm going to go ahead and do is show you what you're going to be responsible for from here on out, okay? The procedure that we're going to be doing in SUR 200 will be the breast biopsy. So let's get into it. The first thing that I'm gonna go do is check my room assignment. That's the very first thing that I do. I come in, I check my room assignment. Now, you have been taught to go ahead and do your surgical scrub before you even check your room. Continue to do that, all right? But for your assessment, I'm gonna check my room assignment, find out where I am, who's my surgeon, who I'm gonna be working with, everything. Once I do that, I'm gonna go ahead and perform my 2 to 3 minute hand wash. Video inserted now. Now that the 2 to 3 minute hand wash has been completed, I'm going to damp dust my room. One thing that I like to do is keep my purple gloves, keep a bunch of extra purple gloves in my pockets. It makes things a little bit easier, okay? So we'll go ahead, put on my purple gloves. I'm gonna go grab a Clorox wipe, be right back. So I have a wipe and a towel. At this point, I'm gonna go ahead and wipe down all horizontal spaces. Get them all clean. And you're probably like, why do you have the towel? Well, if you notice, these Clorox wipes are a little bit wet. So I go ahead and grab a towel as well, so I can go ahead and wipe everything down. In the real OR, you're just gonna use your wipe, okay? But I don't want to place my items down on super wet surfaces. Okay? I'm also going to come through, get my lights. I would do the bed and any other horizontal surfaces. Once I'm done with that, then I'm going to discard my gloves. Glove to glove, skin to skin. All right? Go ahead and dispose, get rid of it. You guys know me, I'm gonna go ahead and get some hand sanitizer, just because that's the person that I am. The very next thing that I'm going to do is check my equipment. Where am I gonna find where my equipment is? Well, I'm gonna check the surgeon's preference card. I know that I'm doing a breast biopsy because I checked that when I first got in. So, I've got Dr. Samuel J. Davis, supine, unaffected, arm may be tucked, pillows under the knees, so I know that I need extra pillows so that I can have those under the knees. I'm gonna have to ask if he wants a shoulder roll because on his surgeon's preference card, there says a shoulder roll. ESU. I have my ESU unit. I'm going to check to make sure that one, it works. So I'm gonna turn it on. You'll hear a dee, dee, dee. And then I also see that the standard settings for this particular surgeon is 30-30. What does that mean? That means that when he's doing his cases, he prefers to have his settings 30 cut as well as 30 coagulate. So I'm gonna go ahead and turn it up, turn it up. The next thing I'm gonna check is suction. This is where you would get your suction, make sure that there's liners in place. Video picture inserted here. Making sure that the liner's there, making sure that there's no bioburden in there, making sure that there's nothing in there that's not supposed to be there. The next thing is that my surgeon wants a patient warmer. So I'll grab my patient's warmer, whether it's a full length, lower leg, have that ready. Usually that's gonna be near the anesthesia part. So we'll just let the anesthesia know if they're not available, or the anesthesia tech, hey, the surgeon wants a upper level, lower level warmer. Surgeon has step stools. So I'll make sure that there's step stools in the room, ready to go, as well as an SCD machine. A lot of times in these cases, the patients are supine or prone or whatever they're in for a while. So the surgeon will put on the SCD machine to keep the circulating going. This is what it looks like right here. All right, other things that I'm gonna be looking for is sutures. So go ahead and grab the sutures that the surgeon needs. Once I've grabbed them, I go ahead and put these in my pocket as well, okay? I find my sutures based on my surgeon's preference. Now that we've gotten our sutures out of the way, the next thing that we're going to do is arrange all the equipment, putting it in the place that the surgeon is going to need. What am I talking about? Well, I've already checked the ESU unit, but in the particular surgeon's preference, the surgeon tells me where he wants it, whether it's gonna be at the foot of the bed, head of the bed, side of the bed, whatever. That's where I'm gonna go ahead and place this at the foot of the bed. But I'm gonna continue to keep my surgeon's preference card because I'm gonna reference it a lot. We're gathering all of our equipment, okay? I've checked the surgeon's preference card, I've kept it open, I'm gonna keep it open throughout the duration. The next thing that I'm going to do is go to my case cart and grab all my items needed for my case cart. This is mimicking my case cart, and I'm bringing it from outside to in. And I'm gonna place it in an area where I can start to open up. So I'm grabbing my items. Before I place any of my items, I'm going to check the integrity. I would have pulled this out of the bag that it was in, the plastic protection. I'm gonna actually lift it up once I pulled it out. I'm checking for any tears, rips, watermarks, pulls, anything that would deem this non-usable. Once I've done that, I'm gonna place it where it's supposed to go. Same thing for each and every single item. I'm checking my single basin. I've pulled it out of the wrapper. Make sure you verbalize that. I pulled it out of the protective wrapper. Now I'm checking for the integrity, any holes, tears, rips, anything that would compromise this particular item. And then I'm going to place it where it's supposed to go. While I'm placing the items, I'm also moving them so that I can actually be able to use them, okay? These are all my pill pack items. I normally go ahead and place this on my Mayo stand or anywhere that I can get out of the way. The last thing that I'm going to check that's a really big part is going to be my instruments, making sure that the locks are indeed still locked. Once I've done that, I'm gonna go ahead and place this onto my prep stand. Remember, as we've mentioned, in the real world, you're gonna place them anywhere that you can. Per the book, it has to be on the prep stand. The other items that I'm gonna make sure that I grab are going to be surgeon's gloves, my gloves, anything else that is needed for the case. Okay, so as you can see, I am in my proper OR attire. I have my gown on, my ID badge. I tend to kind of tuck so that it doesn't get in the way, kind of snap it up, make sure I look like a nerd. And then here we go, back table. We're gonna go ahead and open up our back table first. And if you're noticing, I'm gonna make a lot of adjustments just to make sure that I'm not contaminating, okay? And since we're saving these, we're just gonna stick them on the side. Normally, we would just rip these off and toss them. So I've already checked to make sure that there was no watermarks, holes, or anything. So then I'm gonna open it. This is the only time where you can kind of adjust. I'm gonna come to one side first. All right? And remember, these can move. Now I'm gonna come to the other side. and then I'm gonna move it in place, okay? The next thing that I'm going to open is going to be my basin. The first flap should always be away from you, correct? So I'm gonna go ahead and do that. Then the next flap should be on the sides, all kinds of, and you have to adjust. When you see something like this happen, you have to make sure that it works for you, because the last one needs to be to you. So you can see it was folded incorrectly, but I was still able to open it sterile. So, recap: back table, single basin, and now my instruments. For your instruments, you're going to make sure that you check to see if the steam indicator has changed, letting us know that the parameters for sterilization have been met. So I'm checking. I'm going to break the tamper seals. All right? Up and back. One thing that you'll notice is my eyes stay focused on my field. Then, I want you guys to be checking up, letting us know that you're actually checking these filters. Once again, you're checking the filters, making sure that there's no watermarks, there's no holes, there's no punctures. There's nothing that is going to cause this set to be compromised. This is the part where you guys have not done yet. We're going to be popping up items on this particular case. And anytime you pop up something, it's going to be the same. You're still looking for watermarks, tears, holes, anything that can compromise this particular item. First thing that I have is my Raytex. The other thing that you have to be able to do is secure your sharps. What does that mean? You're going to place your sharps on one end or the other. All your sharps should stay on one side, all your other items should stay on the other. So as I'm opening this, I'm making sure that I'm not reaching over my field. I'm making sure that I'm a safe distance to be able to pop it up. And you're getting rid of your trash as you go. You notice the next item is going to be, in this particular case, my light handles. Same thing. I'm checking, making sure that there's no holes, there's no rips, there's no tears. And then I'm opening it and placing everything on one side that's not a sharp. Okay, pop. Then my sutures. Okay, with each suture, you're going to make sure that you pop it up into a way that you're not contaminating. So, you're gonna go ahead and open up the package and pop it up. Let me open up another suture for you. I'm opening up the suture and popping it up. One more. Popping it up. Making sure that that doesn't touch your fingers or anything like that. If at any point your finger comes across, it's considered contaminated, all right? Also, save these packages for your nurse, all right? When we get ready to do the count, they're gonna compare sometimes. If there is an incorrect count, they'll be able to compare the suture packages with what you have on your field. All right, so once we have everything else open, back table, double basin, instruments, the last thing you're gonna pop up after your pull packs is gonna be your particular gown and gloves. Don't forget your surgeon's gloves, okay? So, since you have to pop up your surgeon's gloves, make sure you have your top gloves and your surgeon's gloves. So you'll be popping up 2 pairs of gloves. So, you open up this part on your back table. And I use my pockets a lot. I and most people do not like you having anything on trash on the ground. Same thing with my gown. I'm checking for any rips or tears. I'm gonna pull this out of the package. This is just a dust cover. That's all that is, a dust cover. Okay? Now that you have the dust cover, you're gonna go ahead and open it. you guys all know how to do. Okay? And you're gonna put on your indicator gloves onto your handstand. At this point, you have to make sure, now that everything's open, the last thing you have to do is ask your circulator to open up your sterile field. Circulator, will you please watch my sterile field? I'm going to go scrub. One of the things that you're gonna make sure you do when you get ready to scrub is remove your jacket. Okay, so normally this would go in the trash, right? But I'm doing demos, so I'm putting it back. Okay? Then I'm gonna grab my brush. I'm gonna start with my left hand first.
Okay, it says begin timing or counting stroke scrub technique. Begin scrub with nails. Pass fingernails back and forth across the sponge. Counted method, nails 30 strokes per hand.
All right, real time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You guys are probably gonna do it, which is fine. We get it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30. Okay?
Okay. Or it says time 2 minutes. 2 minutes for each hand. Each finger has 4 planes.
1, 2, 3, and 4.
Scrub each plane of each finger individually between the fingers in the webbed spaces. Counted method is 10 strokes for each side of each finger and thumb, or timed is continuous of 2 minutes for the entire hand.
All right, key. More stuff you have, the better. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you just go through all of them.
You can either pop it on her field or you can give it to her hand.
And if you notice, I tend to not take my brush off, that's just the way we were trained. People do, you see people pull their hands off the brush. I do old school. This is how we were trained in the Navy.
Is that a sterile package? But is this sterile glove package ever look like?
Okay, now what?
Scrub dorsal and palm side of the hand. Counted method 30 strokes for each side of hand, or 1 minute for each side of hand.
Same thing. 30. I'm going to cut this down a little bit. 30. Now, at this point, you are authorized to flip your sponge. You don't have to use this brush part the whole time. Okay?
For your okay. The forearm has 4 planes. Scrub each plane separately in circular motion to 2 inches above the elbow. Counted method 10 strokes for each of the 4 planes, or 1 minute for each arm, 2 inches above the elbow, covering all 4 planes.
The person scrubbing in should be opening their stuff too. Whoever's scrubbing in your field should always break down the stuff.
Now, I'm coming back into the room, backing up. And now I'm going to sterilely grab my towel. Okay? And the key, especially for those who are taller, is to making sure you get as much dry as you possibly can. All right? Underneath. Okay? And toss your trash. A lot of people go like this. That is a bad habit in the operating room. The reason being is you don't want to wave and potentially cause any more issues. So once you've dried your hands, you dried your hands. Okay? Now, you're going to pinch the gown at the smiley face, and you're going to step back. When you do that, your hands should go straight into the sleeve parts. Now, remember I said, don't wait for your circulator. Go ahead, let them know, hey, I'm moving. I'm gonna go ahead and gown or glove myself. Okay? Now, remember, if your fingers come out of here, that's unsterile. So one of the tricks that I like to do when I'm gowning and gloving is I take my gloves right here and I go ahead and stick my fingers in a little bit and come through. Okay? Once your fingers are kind of in, you're golden. All right, and then I repeat for the other side. And remember, my fingers never came out of the green or came out of the white part, all right? So that way, I kind of like my cuff to kind of be. Your circulator has given you back your tie. You can go ahead and tie yourself up. Do not go to your sterile field until you've been tied, all right? Now, if you don't have a circulator, you can go ahead and do this. If you do have a circulator, just simply ask them to get that for you, okay? Before I do anything else, I like to go ahead and put on my second pair of gloves. And for these ones, it doesn't even matter. You just get them on. There's no particular reason, no particular way. You're just putting them on your hands so that you can scrub. Get as many sterile fields open as possible, all right? So that's exactly what I'm going to do. Actually, I'm gonna save this because I'll use it later. First thing that I wanna grab is going to be my nail stand. This is my workhorse, okay? Once you gown and glove, 12 minutes starts. So as soon as you walk up to your glove, that is exactly when we're gonna start your 12 minutes. You should be done with your setup, with medications and everything by the time 12 minutes is over. So, as I'm preparing, I'm trying to make every movement count. I know that my sutures and my sharps are gonna come right here, so I'm gonna keep them here. The next thing that I know that I'm gonna wanna do is get my drapes together. So I know that my half sheet goes first, and then I have 4 towels. 1 away, 3 towards. Drapes are ready. The next thing I'm gonna do is grab my basin. I like to make every movement count. The only reason I'm grabbing my basin now is because I know that the items in my basin are going to be needed for my count, and that's already in position. Next thing I do, put my drapes, surgeon's gown, and of course my surgeon's gloves are in here. They are ready to go. Out of the way. Once that's done, I'm gonna go ahead and get my towel ready. And you'll notice that I am a minimalist. Okay, this is gonna go here, and I need 2 more roll towels. Okay? The roll towel is going to be the key to having a good, really comfortability during your case. You guys are required to have 1 on your back table and 1 on your Mayo stand. You'll notice that the one on the Mayo stand is folded this way versus the one on your back table, I fold it that way. There is no preference. You're gonna do what works best for you. Okay? Boom, boom. Now I'm ready to receive my instruments. In your instrument tray, there is a sheet of paper. You are going to immediately give this to your circulator. You're going to check. I see my indicator, and I'm gonna go ahead and give that immediately to my circulator, all right? Then, you're going to make sure that you do not contaminate, and you're just gonna walk back. If you notice what I did is I picked up, and walked back. That way, when my circulator tells me that it's okay, which they did, I immediately move, and I'm ready to go. All right? From here, you're just moving. You have to have your safety section on your back table as well as on your mayo stand. Put your knife handles where they need to go until you're ready for them. And at this point, you're just moving. I like to keep everything in the same spot every time I set up. So pickups with teeth, I usually put on one side. Pickups with teeth, that way pickups without teeth will go on the other. Okay? Without teeth, without teeth. The biggest goal is you're trying to get ready to count. I usually take the towels all the way out, that way I know exactly what things are. I also keep light instruments together. Legs, arminays. And my manual. At this point, you're actually ready to count, meaning you are ready to go through with your circulator. But let's say they're busy. You keep moving, okay? You get your items that you need ready to go. I've got free ties and I've got my sutures. I know that I'm going to need local. This is going to be one of the first things that goes up. And then it's the cleanup. Right now, I'm ready to count. The next time you see me, we're going to do the real demo, and we're going to start right here at ready to count for this breast biopsy. Whenever we do a live demo, the setup, this part will stay the same. The only difference is what you're putting up on your mayo stand and on your back table, and how we will go forth with the case. But we expect you to be able to do this exact same part for the setup. When I see you on Wednesday, we are going to jump in right here. I'm going to be the circulator, I'm going to be the scrub. I'm going to pull somebody to be my circulator so that we can go through properly counting, properly receiving medications, and properly getting ready to do the case. Make sure that you have a pen and paper and any other questions that you may have had from this demo.